Assalamu alaikum. I am Saiful Islam. Today I would like to explain a clinical case about respiratory failure that I shared previously in the form of a quiz. The question was a 65 years aged male known case of COPD admitted in unconscious state for 2 hours ago. After analyzing his arterial blood gas that reveals pH 7.25, partial oxygen level is 60 mm of mercury and partial carbon dioxide level is 65 mm of mercury. So, what is your diagnosis? Before answering the questions, we have to know what is respiratory failure, its types, arterial blood gas, sign symptom of respiratory failure. So, let's begin. By definition, the term respiratory failure means when pulmonary gas exchange fails to maintain normal arterial oxygen and carbon dioxide levels. It's called respiratory failure. We can classify respiratory failure two types: type 1 respiratory failure and type 2 respiratory failure. In case of type 1 respiratory failure, we find hypoxemia but without hypercapnia. And in case of type 2 respiratory failure, we find hypoxemia with hypercapnia. Now I would like to explain about normal level of arterial blood gas. The normal level of partial oxygen is 80 to 100 millimeter of mercury and the normal level of partial carbon dioxide is 35 to 45 millimeter of mercury, and the normal level of pH is 7.35 to 7.45 and bicarbonate level is 22 to 26 milliequivalent per liter. So hypoxemia means when partial oxygen is less than 60 millimeter of mercury, we called hypoxemia. When partial carbon dioxide level is greater than 45 millimeter of mercury, we called it hypercapnia. When pH level is less than 7.35, it's called acidosis, and when pH level is more than 7.45 is called alkalosis. Now let's discuss about the sign symptom of respiratory failure. For hypercapnia, we will find warm periphery, rapid bounding pulse, flapping tremor. And for hypoxemia, we will find central cyanosis, confusion, and patient may have headache. So, as the question stated, the patient was unconscious and the patient partial oxygen level in 60 millimeter mercury. So, patient have hypoxemia. And patient partial carbon dioxide is 65 millimeter of mercury. So, patient have hypercapnia. As pH level is 7.25, so patient have acidosis. We already discussed hypoxemia and hypercapnia that are associated with type 2 respiratory failure. So our appropriate answer is COPD with type 2 respiratory failure with respiratory acidosis. Thank you everyone.